My name is Benjamin Chimukangara. I'm from Zimbabwe. I'm currently a PhD student within KRISP, and I'm also involved in KRISP research projects as a research scientist. So I've always wanted to be part of a research group in Africa that conducts biomedical research that has an impact on African populations and the world at large. So joining KRISP was an opportunity that I could not let go, considering the great infrastructure, the equipment, the experience within KRISP, as well as the room in KRISP that is there for scientific innovation, as well as conducting cutting-edge research. One of my most recent papers was on community-based antiretroviral treatment in Zimbabwe. This research project involved HIV patients that were receiving donor-funded HIV drugs. So these patients had adherent support through an outreach program, but they lacked HIV treatment monitoring tests such as viral loads and drug resistance tests. So what we would do is we would drive out to this rural community, which was about 200 kilometers away from the laboratory, and we would go there once every 6 months for a period of up to 2 years. And during that period, we would collect blood samples in a single day visit, and we would take those samples back to a centralized laboratory where we would test them for drug resistance mutations and viral loads. So our key findings from that research were quite interesting. Greater than 90% of the 143 patients that were enrolled in that study achieved viral loads less than 1,000 copies per mil throughout the 2-year follow-up period. These results were unexpected, but they were remarkable in showing that HIV treatment monitoring with adherent support and community-driven art can sustain viral suppression rates, even in patients that are receiving the most basic antiretroviral treatment drugs. So that's my primary focus at the moment, looking at pre-treatment drug resistance and understanding how it has implications on the current treatment regimens that are available in our setting. So the KRISP environment, with the infrastructure that is available and the equipment, high-tech equipment that is available at KRISP, has helped a lot, especially with part of my write-up too, as I was doing my write-ups for these papers, as well as providing me an environment where I have other researchers around me that help to contribute to the scientific knowledge that I try and put into papers and publish for the public to read.